The Trump administration has given the green light to silver loading premiums in the marketplace, mostly because they can't get regulations written in time for the next open enrollment period. Let's get you caught up on what it is we're talking about when we say silver loading. This goes back to the decision by the Trump administration to not fund cost-sharing reductions, those assistance to people for out-of-pocket costs in the marketplace, to bring those down. Insurance companies still have to provide cost-sharing reductions. They just won't get reimbursed by the federal government to do so. Insurance companies, not wanting to exhibit any more expense than they need to, are making up for that loss of funding by increasing premiums. That cost gets passed on to consumers, except in the case where consumers get enhanced tax subsidies to cover those premium increases. So for individuals up to 400% of the federal poverty level, their tax subsidies will increase as their premiums increase, and they're going to notice very little premium change for the next open enrollment period. Well, a lot of insurance companies, when they heard that cost-sharing reductions were not going to be funded, but they still had to offer them to consumers, decided to put those premium increases largely on those silver plans that equaled tax subsidies to the consumer, so the consumer wouldn't notice essentially the increase in cost. That's called silver loading, where you make up for a lot of the losses you're going to experience in your marketplace as an insurer on the plan where the cost is not necessarily going to get passed on to the consumer. It'll instead be offset by tax subsidies, which the federal government has to provide and compensate the insurer for. So this is silver loading. The Department of Health and Human Services Secretary Azar was questioned in front of the Congress of, are you going to allow this silver loading to continue into the next marketplace open enrollment? And he said, yes, we have to. We don't have regulations that say you can't do this. And even if we wanted to, we can't get it written in time to be effective for plans that are going to be sold for 2019 coverage that will be sold at the end of 2018. So who's paying more for all of this? The same federal government that didn't want to pay for cost-sharing reductions. They're going to end up paying a lot more in tax subsidies to these same insurers instead of paying more in cost-sharing reductions. So the cost to the federal government is going up more than it would have if it would have just funded cost-sharing reductions in the first place. The good news for most consumers is they won't notice a change. If their premium statement goes up, their tax subsidy should go up. That's not going to be the case for consumers that have incomes over 400% of the federal poverty level, however. If they are still buying a silver plan and they're not seeing tax subsidies along with it because their income's a little too high, they will experience the full force of that premium increase. That's a little update on what's going on. We thought we'd share it with you. You can read more on Secretary Azar's statement that goes into a little bit more detail on this whole conversation of silver loading. There's a nice article by Fierce Healthcare that puts this together for you. If you have more questions about silver loading or what premiums in the marketplace will look like in 2019, you can send us your question or send us an email, and you can do that at healthwatchwisconsin.org.